Hi YouTube. A couple of months ago I made a video called Obama's Socialist Healthcare Program, Kiss Your Mama Goodbye. And I got some comments. People told me I was delusional, I was paranoid, I didn't know what I was talking about. People said, Obama won, you lost, get over it. So I thought I'd make another video and kind of clarify what I was talking about and show you that I am not paranoid or delusional. This is in the bill. This is from an article that was in Bloomberg on February 9th. These healthcare provisions reflect the handiwork of Tom Daschle. It's exactly what I told you. That even though Daschle wasn't going to be the Health and Human Services Secretary, his plan was still going to be enacted, and that is the plan that went into the stimulus package and got passed while nobody was looking. Just like I said it was going to. There will be new penalties. Hospitals and doctors that are not meaningful users, that is quote unquote meaningful users of the new system, will face penalties. Now, the term meaningful user is not defined in the bill. That's completely left to the discretion of the Health and Human Services Secretary. And this secretary will be empowered to impose more stringent measures of meaningful use over time, whatever that means. I guess it means what the secretary considers meaningful use of a doctor's skills, abilities, and a hospital's amenities, I would think. What is meaningful use? The vagueness is intentional. In his book, Daschle proposed an appointed body with vast powers to make the tough decisions elected politicians won't make. Now tell me, what kind of tough decisions do doctors have to make? I can only think of one. Can you? This stimulus bill does that and calls it the Federal Coordinating Council for Comparative Effectiveness Research, to see how comparatively effective different treatments are, right? The goal, Daschle's book explains, is to slow the development and use, seriously, to slow the development and use of new medications and technologies because they are driving up costs. That's a quote from his book. He also praises Europeans for being more willing to accept quote unquote hopeless diagnoses and quote forego experimental treatments, end quote. And he chastises Americans for expecting too much from the healthcare system. Now, the elderly will be the hardest hit, which is why I had entitled my video Kiss Your Mama Goodbye. I was not being paranoid or delusional. Daschle says healthcare reform, quote, will not be pain-free. In other words, somebody's going to suffer because of the healthcare reform. Seniors should be more accepting of the conditions that come with age instead of treating them. Medicare now pays for treatments deemed safe and effective. The stimulus bill changes that and applies a cost-effectiveness standard set by the Federal Council. The Federal Council is modeled after a UK board discussed in Daschle's book. This board approves or rejects treatments using a formula that divides the cost of the treatment by the number of years the patient is likely to benefit. Treatments for younger patients are more often approved than treatments for diseases that affect the elderly, such as osteoporosis. Just as an example, in 2006, this UK Health Board decreed that elderly patients, see, I mentioned this in my video, you told me I was crazy. They decreed that elderly patients with macular degeneration had to wait until they went blind in one eye before they could get a costly new drug to save the other eye. It took almost 3 years of public protest before the board reversed its decision. If Obama's administration's economic stimulus package passes the Senate in its current form, which it already has, this was written in February, seniors in the U.S. will face similar rationing. Defenders of the system say that individuals benefit in younger years and sacrifice later. These are the defenders of the plan. It's okay with them if you sacrifice later, all you elderly people. That's okay, because you would have benefited in your younger years if we'd have had the program, I guess. Hiding health legislation in a stimulus bill is intentional. Daschle supported the Clinton administration's health care overhaul in 1994 and attributed its failure to debate and delay. A year ago, Daschle wrote that the next president should act quickly before critics mount an opposition. If that means, this is a quote, if that means attaching a health care plan to the federal budget, so be it, he said. Quote, the issue is too important to be stalled by Senate protocol, end quote. I just made this video to tell you I am not crazy. I do know what I'm talking about. Look up H.R. 1 or H.R. 676. Look it up. Don't take my word for it, but don't call me crazy or delusional before you've even looked it up or you even know what you're talking about. You know, there's nothing that irritates me more than some ignorant person telling me that I'm ignorant. So, you people, my subscribers and friends, have a good evening. Enjoy your rest of your week. And to all of my haters, look it up. Look it up.